right. Welcome. Today I'm going to talk about how rice farming societies suffered fewer COVID-19 cases during the pandemic. So I want to start with the global rankings that came out just before the pandemic from Johns Hopkins University. So this was 2019 Global Health Security Index. And what they were trying to do was to predict which countries were going to be able to handle health crises, threats to the healthcare system and people's health. Which countries would do better and which countries would do worse? Which countries were more prepared and which countries were less prepared. And they weren't trying to predict COVID specifically, but sort of health threats in general, which would include things like COVID. And these rankings just so happened to come out right before COVID struck the world. And if you look at their rankings, here are the rankings just from lower is less prepared, higher on the graph here is more prepared. If you look at the rankings, rich Western countries like Canada, the UK, the US were at the top of the rankings, most prepared here. And if you look, say over here, you have a lot of poorer countries that are less prepared, and even some countries that are fairly wealthy like Singapore and Japan also falling farther below in the rankings. Now, I think you can imagine where this is headed if we look at, for example, cumulative COVID cases in actuality. Some of the worst places in the world are the United States, the UK, France, Iceland. These are, wealthy Western countries that led the preparedness rankings, actually did the worst when it came to actual COVID. So I think there's a bit of a puzzle here. Why did the rankings get these so wrong? Why was there such a disconnect between these predictions and the actual outcomes? I'm going to argue that a lot of poor cultures, and some rich ones too, have cultural strengths that are hard to count and hard to quantify. And so in a way, I'm not going to blame Johns Hopkins for not being able to count or measure these sorts of cultural strengths. I just think they're sort of hard to measure in the first place. And instead, what those rankings did was to prioritize things that were easy to count, easy to measure, easy to tally, right? So how many hospitals are there? How much funding is there for medical research? How many factories do they have producing X, Y, and Z, right? Things that are easy to count and tabulate and put a number on, well, those went into the rankings. Things that are hard and sort of soft and squishy and a little fuzzy like culture, those don't go into the rankings because they're hard to measure, and also because I think there's a lot of disagreement about whether cultural factors even matter. So I'm going to argue that cultural factors do matter, and did matter, and we have it in the data. So I'm going to link these one source of cultural variation to rice farming. So here's an image of a map of rice farming around the world. You can see a lot centers in East Asia, Southeast Asia, South Asia. There is also some, in Africa and South America as well. Now, okay, why would rice have anything to do with COVID-19? I'm going to argue for a few different reasons why this would be linked to COVID-19. First, if you think about a traditional paddy rice, one of the fundamental things about paddy rice is that it's built on irrigation networks. Those irrigation networks mean that rice farmers have to coordinate when they fill and when they drain their fields. It means my water use affects your water use and vice versa. And so this leads to a strong sense of social norms. Traditional rice villages often had a lot of social monitoring and work assignments to navigate these sorts of shared infrastructure. And so, for example, rice villages in China, anthropologists would observe rice villagers who would monitor each other, say who's showing up for work assignments today, how much water is this person using, are they did they help dredge the channels of the irrigation network when they were supposed to. There's a lot of informal and formal monitoring going on in these irrigation systems because they're shared networks, right? Second, rice requires a lot of labor. We know that compared to crops like wheat, corn, millet, a lot of the crops that formed the sort of the basis of Western culture, rice required a lot more work per acre than those crops. We know this from anthropologists who observed traditional rice farming and wheat farming and things like that. Why this is important for culture is because rice villages would form cooperative labor exchanges. So you would help me farm my plot, I would help you farm your plot, or I would enlist extended family members to help me farm my plot. And what this meant for culture and for society is that individual farmers were much more linked together with these sorts of duties and responsibilities. Now, in fairness, farmers around the world did do labor exchanges. So, for example, my grandfather grew up on a corn farm in Kansas, and they had, for example, barn raisings where neighbors would come together and help build a barn. Right? Building a barn was a lot of work, so neighbors would help each other out. But if you look at anthropology work explicitly comparing labor exchange systems in different cultures with different crops, what they find is that the labor exchange in rice villages was much more tight and sort of binding. This was a crucial part of everyday life. And so, for example, in one study, they compared farmers in the Congo versus rice farmers in Japan. And what they found is that the rice farmers in Japan took these sorts of duties they viewed this sort of help as a strong reciprocal duty, whereas the labor exchange in the Congo was much more like a festival. So people would sort of show up throughout the day. The host would provide homemade beer and other snacks, and work would get done, but it was a lot more sort of loose and informal and sort of fun. The labor exchanges in rice villages were not fun. And in fact, if a farmer would accept help in the first place, and then let's say I got injured or I got sick and I couldn't repay it, oftentimes farmers would go to great lengths to actually hire other laborers to go repay the sort of labor debt. So there's a lot of sort of tight ties between individual farmers there. So here's sort of the theory in a nutshell. So with historical rice farming over years and generations, rice farming villages have these sort of tight social norms, sort of low relational mobility that comes with this sort of sedentary rice farming and tight ties between people. And those social structures are going to help societies prevent COVID-19. So to be able to test this, colleagues and I gathered COVID data from the World Health Organization. We specifically wanted to look at the period prior to vaccination. The story could well be different sort of after vaccination. Vaccines might represent finally the flourishing of some of those healthcare infrastructure tools that the Johns Hopkins ratings were quantifying. But I want to look at sort of this early time period, the first year or so before vaccines were available. So we're looking from January 2020 into January 2021, which is about the time that vaccines really started to have an impact. And we're looking at 131 countries across the world here. To measure rice, we took rice data on the amount of harvested area for rice divided by the total cereal area. This gets at sort of, by dividing by the cereal area, what we're doing is sort of looking at rice as a percentage of the sort of staple crops, right? For example, if you have cropland devoted to strawberries, that's probably not a historically important staple crop for the area. Instead, cereals like rice and corn and wheat, those tend to be what are sort of the fundament of societies. As an alternative, we also looked at rice output per capita. So I'll show you a few analyses with that. Basically, the finding there is that you can measure it different ways, and the outcome is robust regardless of how you measure it. So here's the basic finding. So on the one side here, we've got rice output, and then we have the number of cumulative coronavirus cases on the y-axis there. I have it binned over here on the other side, and so you can see, for example, that the countries with the most rice had about 129 coronavirus cases per population. Compare that to societies with essentially zero rice, where they're suffering over 8,000 cases per capita. pretty wild difference there. One downside of counting coronavirus cases, though, is that some countries are doing more testing and they'll be able to discover more cases simply because they're doing more testing. Deaths are a bit easier to count, a bit more sort of obvious things that don't depend as much on testing. Here are coronavirus deaths with rice here, and then we have it binned on the right side. At the extremes here, you have 143 deaths per population in countries with basically zero rice, and down to 3 in countries with the most rice. I mean, we're talking about very, very large differences here. Now, to test our model between sort of rice, relational mobility, cultural tightness, and then COVID cases, we did a simultaneous mediation model, and what we found is that both were related to COVID cases. We have a separate model for deaths. I won't show that here. Cultural tightness seemed to mediate more of the effect, 45% of the effect. Relational mobility, 22% of the effect. I'll get into sort of these mechanisms a little bit more in a minute, but first I want to ask a few other questions of the data. First, you might ask, cultural tightness and relational mobility, are those kind of just measuring the same thing? I mean, tight cultures tend to have low relational mobility. They are, in fact, correlated, but not strongly, right? A correlation of about 0.4 that leaves a lot of variation that's not explained by both of them at the same time. So it does seem to be legitimate to include both in the same model. Next, I'm going to show you sort of the regression results where we're trying to control for a lot of different elements, a lot of potential confounds. One interesting thing to note here, GDP per capita here on the top line. On the left, we have cases. On the right, we have deaths. GDP is significant in predicting more COVID cases and more deaths. And so this is sort of contradicting that Johns Hopkins data where rich countries tended to do better on the rankings. Here we're seeing that they're actually doing worse. They're having more COVID cases and more deaths. So a bit of a paradox here. Wealth seems to be worse for COVID outcomes. Next, we have a few measures of sort of societal openness. We've got foreign investment, trade, freedom index, income inequality. Most of these are not significantly predictive of the outcomes. You'd think these might account for why some of the developed democracies did worse, but at least measured by these indexes of sort of openness and freedom, they don't seem to be explaining a whole lot. We also looked at historical disease prevalence. So you might say that countries that have been poor over the course of their history, or countries that, for example, grow rice tend to be hot in hot climates. Maybe they have a larger history of disease, and that prepared them better for the pandemic. We actually don't find that the history of disease in different countries mattered much for COVID outcomes. One serious potential confound is underreporting, right? So if places are testing less, or maybe they're categorizing COVID deaths as non-COVID deaths for political reasons, that could be a serious threat to the data. I thought the best metric of underreporting was this ranking, sort of data output from the Institute of Health Metrics and Evaluation. That's in the United States. What they did is they looked at death records, just overall death records, to say how much did death increase in different countries, and then how many deaths did those countries report from COVID. And then what they were able to do is to estimate the sort of underreporting in different countries. So you see a lot of underreporting evidence in places like Russia and Kazakhstan and Egypt, and less underreporting throughout Europe. North America also sort of moderate in the underreporting there. And so when we took into account underreporting and said, okay, let's multiply the number of deaths by this sort of underreporting factor, what we find is that rice remains significant. So underreporting does not seem to be able to explain these differences. Another way to measure this is to say, okay, well, how much testing did different countries do? Even accounting for testing, rice remains significant. So underreporting and testing does not seem to be explaining these differences. So what we have here is that rice societies are doing better overall, but there's an interesting wrinkle with time here. So what I'm going to show you next is the results that are broken, where we break down that year into 3 different chunks. So I'm going to show you January to May, sort of early pandemic, then mid, sort of June to September, the sort of summer period, and then the sort of fall and winter, October to January 2021. So I'm going to break down those results by those 3 time periods. Now, first things first, Rice predicts coronavirus cases across these 3 time periods. So Rice seems to be fairly consistent across those time periods. But if we look at relational mobility, it's only significant in that early time period. So relational mobility predicts more cases early in the pandemic, and then it becomes non-significant. It actually reverses sign later in the pandemic in that 3rd time period. The story is flipped if we look at norm tightness. So norm tightness starts off non-significant, and then it becomes significant, and then even stronger in that 3rd time period. So we have relational mobility mattering early and then sort of fading, and then it sort of hands the baton off to norm tightness. What's going on? Why would the effects of these mechanisms differ over time? Here's sort of my speculative explanation here. So in societies with high relational mobility, there's a sort of more relationships, more socializing, networks are more flexible. And so when COVID hits, it can spread through those mobile networks, right? If you're meeting more new people, hanging out with more people, COVID is going to spread through those sorts of social activities and those social contacts. But there's actually evidence that relationally mobile cultures actually cut their mobility more than low mobility cultures once the outbreak started to get bad, right? There's a great paper by Freeman and Shug on this, and they explain that relational mobility is not just hanging out with a lot of people, seeing people, having flexible networks. It also means the freedom to adjust how social we are. And so what they found is that before COVID got bad in different cultures, relationally mobile cultures were more mobile. This is measured by this is geographic mobility, so measured through people's smartphones. But as the pandemic tended to get worse in each culture, the high mobility cultures in the dark line here, they actually cut their mobility more drastically than low mobility cultures, right? So high relational mobility cultures seem to have the sort of freedom and flexibility to cut ties, to see fewer people when the situation gets bad, right? So yes, it gets bad in the first place with relational mobility, but then they're able to adjust over time. So that could explain why we see sort of worse outcomes in the beginning, and then relational mobility seems to not matter as much later. We've got the flip with norm tightness. So at first, I'm going to argue that there was sort of confusion and there weren't sort of broadly shared norms. As one small example, I'll talk about how there was a lot of confusion about masks. Here's the U.S. Surgeon General in February 2020 telling people that masks are not effective at preventing COVID. Right? It's a lot of disagreement, a lot of confusion. In the early days, people weren't even sure whether COVID spread from person to person. Maybe it's mostly a spread by surfaces or other things. So there was a lot of confusion over time, and that could be why norms didn't seem to matter at first. But over time, cultures kind of coalesced, more or less. I mean, there's still disagreement, but agreement tended to spread about the effectiveness of social distancing and masks and closing things and staying home when you're sick, all of these things. As these norms started to spread, then we start to see the effectiveness of norm tightness. So basically, cultures need to figure out what the norms are for COVID before those norms can have an effect. So this could help explain why norms matter more later in the pandemic. So I hope I've seeded the idea that culture matters for disease outcomes, and that these were not reflected in rankings before the pandemic. How much does this matter? I mean, if we look at deaths, if we compare the cultures with the least amount of rice and the most amount of rice, the cultures with the least amount of rice suffered 35 times more deaths per capita than the cultures with the most rice. I mean, this is an astounding difference. So this is literally a question of life or death, and culture seems to matter. Second, what I hope I've done here is sketch out a picture of sort of the long-run persistence of culture from our subsistence style. So, rice farming is this historical practice that cultures did for many generations. Now that's still mattering even in cultures like Singapore or Japan, where most people are not farming. Instead, we can see the legacy of rice farming in these sort of more proximal mechanisms like relational mobility and norm tightness. And so we can we can get this sort of full picture of sort of distal cause, a sort of ultimate cause, to a sort of more proximate mechanism, and then the outcome in modern society, even to a completely new disease, right? A disease that didn't exist before. These long-run cultural practices affected the course of that disease. I think one very serious open question, I hope a question that you're considering right now, is, do we really know that this is causal? I mean, how much of this is just something about East Asia, right? I mean, so much of the rice that's grown in the world is Japan, China, South Korea, and related cultures, where, like Singapore, where you have a lot of immigrants from China. How much of this is just a sort of East Asia versus the rest of the world question? So other research that we're going to present today, a colleague of mine, Alex, will present today, will help address this question by showing you a different way of tackling the data here. So he'll speak more to that. I want to thank my co-authors, especially CS, Alex Shuangwang and Liu Qing, who helped gather all this data, analyze it, and do a lot of the work here. So thank you very much to my collaborators, and thank you for listening.